Good afternoon. Thank you for being here. As we go through our update, we have some information to go over, a couple reminders on the weekend, then we'll take some questions. We have some special guests with us as well. To start out, unfortunately, the reality of the virus is still here, is with us. We've lost a neighbor, Caucasian male in his 80s, in a hospital-related death over the last 24 hours. Certainly, we want to think about him and his family, everyone we've lost over this really heartbreaking pandemic, and think about them and keep them in your thoughts and prayers moving forward into Memorial Day weekend. Related to testing, we have now tested 28,135 individuals. 27,486 tests have been returned. 1,674 tests have come back since yesterday. That is 1,674. Big number. There are now 1,752 positive cases, 42 new cases since yesterday. We'll get into that, but if you want to know the math, I'll give it to you right now. 42 divided by 1,674 is a 2.5% infection rate. Certainly very, very low rate. And we've had 1,752 positive since March 16th. And 25,734 negative results. We sent 759 tests since yesterday out to the labs. We have 649 tests pending. Our infection rate through the period of time is now at 6.4%. Again, when we were doing symptomatic testing and only a little bit of proactive testing, our infection rates 8%, 8.2%, 8.4%. Now, since we've been expanding that, the number is going down. We kind of expected this. We will continue to do universal testing next week at the Syracuse Community Health Center. What that means is if you're sick or not, you can go get a test. We are hosting 2 targeted mobile testing sites this week. Today, at the Pastime Athletic Club parking lot on North Salina Street, we have been doing testing from 9 to 5. And tomorrow we will be doing testing at Dr. Weeks Elementary School on Hawley Ave, again, 9 to 5. If you're interested in pre-registering, go to our county health department's website, pre-register for that test. You can get a time slot where you can come in, but anyone is being tested. Next week, we'll take our mobile testing show on the road, going down to the town of Lafayette at minimum. We'll give more briefings as to if we will hit another town in the southern towns next week. Regionally, we have a mandate as part of Restart, 775 tests on average per day. It's a 7-day rolling average. So it doesn't mean you need to hit it every day, but you need to, over 7 days, average out 775. Good day of testing yesterday. Overall, 1,081 tests done in our region yesterday. Our 7-day average is 1,291 tests from May 14th through May 20th. So exceeding our daily average by quite a bit. 516 tests a day. Hospitalizations, we've talked a lot about this problem we have. It's still a problem, but we'll give you the numbers. 82 individuals in the hospital. It's 4 more from yesterday. Hospitalizations represent about 4% of our hospital capacity in Onondaga County. The hospitalization numbers have gone up significantly from last week. Why do we know this? We know this because we have 40 individuals now. 40 out of the 82. 82 minus 40 is 42. 40 folks are essentially, if they lived in their own homes, would be discharged to their own homes right now out of this 82 number. but due to the executive order right now that the state has, we're trying to work through this. These are folks that lived in nursing homes. They became COVID positive. They were sick enough to go to the hospital, so they go to the hospital. The outcome has been a good outcome for these individuals. They're healthy enough now to leave the hospital, but they need to test negative before they can go back into their nursing home, which is their home. The challenge with that is that once you're COVID positive, you could test positive for a long period of time, even after you've been deemed recovered by the doctors. So this is a challenge. We're working through this. The 82 number is just not a good number when you're looking at the reality of the facts on the ground. The reality is that number should be 42, which would be a significant decrease from where we've been related to hospitalizations. We track these numbers for sick people in hospitals because you track the hospitalization numbers because that's where you go to get better. And so it's not where you go to lodge people. Right now we got to work through this. We're working through it with the state. Hopefully we'll get these people into a position where they're either going back to their homes in a COVID unit, or we're figuring out another area for them to be. But regardless, this 82 number is not a reflection of the impact that COVID-19 is now having on our hospital infrastructure. When we look at who the individuals are in the hospital, 48 are Caucasian, 22 African American, 9 are of another race, 3 have declined to share their demographic information with us. To date, 205 people have been in the hospital and have been released. That included 4 people from yesterday. So on our positive cases, up 42 on the day. Again, 42 out of over 1,600 tests back, 2.5% infection rate. Certainly we don't expect to see those types of infection rates every day, but that is a lot of tests that came back. We now have some data points about asymptomatic cases. Over the last 3 days, 44% of our positives have been asymptomatic. So that means these are individuals who went to get a test, not because they were sick, but more or less they were curious. And what we found is that 44% of people that went over the last 3 days have had some exposure to the virus over a period of time. And so these are people that are healthy. If you're with them, you would never deem them to be sick. They are not sneezing, they are not coughing, they do not have a runny nose or sore throat, but we believe they could spread the virus. So what does that tell us as a community? We need to continue to be very diligent, vigilant. We need to wash our hands. We need to protect ourselves when we're out in public with people, wearing a mask, certainly 6 feet away from each other. This is a reminder that the virus is still here, and it's here in individuals that you wouldn't think are sick. So please remember this going into what's going to be a beautiful weekend as you spend time and remember those who have paid the ultimate sacrifice so we can have this weekend. Please remember, please keep your family safe. There are folks that are asymptomatic in the community, and 44% of the last, 120 cases, 130 cases have been asymptomatic. So we're doing this proactive testing now. We'll continue to find these, and we'll continue to share the information as we get it. 746 active cases, 903 recoveries. That's up 27 people from yesterday. So 27 people have met the CDC guidelines for recovery, meaning 10 days of improvements with symptoms and 3 days of no temperature if you're under 65. If you're over 65, that means 2 weeks of improvements in your health and 3 days of consecutive no temperature. 8 individuals out of our 42 are related to household contacts. 14 individuals are related to senior facilities, being staff and or residents. And 20 individuals are community spread. So out of those community spread numbers, certainly 44% of those are asymptomatic. So, overall, the infection rate number is good. Having that many asymptomatic people in the community is a reflection of that people had exposure to the virus. They didn't get sick, but we still have to be very, very vigilant in protecting our own health. We now have 1,768 people in isolation or quarantine. Number is about the same as yesterday. Again, we went through how you get out of quarantine and isolation. 10 days, improved symptoms, and 3 days no temperature if you're under 65, 2 weeks if you're over 65, and then in a quarantine, you're in a quarantine a minimum of 2 weeks. If you pick up symptoms while you're in the quarantine, that quarantine is going to be extended. So looking at our total cases, 1,033 have been female, 719 male, 65 are under 19 years of age, 280 in their 20s, 214 in their 30s, 216 in their 40s, 279 in their 50s, 233 in their 60s, 182 in their 70s, 176 in their 80s, and 107 in their 90s. So the decades of the 20s and the 50s, 280 and 279, very, very close. Those are our highest decades of individuals who have tested positive for COVID-19. Breakdown by municipality: City of Syracuse, 952 total cases, 415 recoveries. Clay, 139 total cases, 100 recoveries. Onondaga, 128 cases, 34 recoveries. Geddes, 92 cases, 29 recoveries. Salina, 77 cases, 52 recoveries. Manlius, 67 cases, 55 recoveries. DeWitt, 63 cases, 53 recoveries. Cicero, 60 cases, 35 recoveries. Camillus, 55 cases, 37 recoveries. Lysander, 33 cases, 27 recoveries. Pompey, 24 cases and 22 recoveries. Van Buren, 22 cases, 9 recoveries. Skaneateles, 15 cases and 15 recoveries. Marcellus, 7 cases and 4 recoveries. Lafayette, 5 cases and 3 recoveries. Atisco, 5 cases, 5 recoveries. Elbridge, Fabius, Spafford, and Tully, 2 cases and 2 recoveries. Looking at physical distancing, you know, the news that everyone should really be paying attention to are these asymptomatic cases. So anyone can be asymptomatic. You wouldn't know you were sick unless you go get tested. And so I think that we need to be smart and recognize that and continue to be very, very vigilant. Restart, reminder, Saturday, May 23rd, 10 a.m., the zoo will be open again. Reservations can be made online starting tomorrow at 9 a.m. via the park's website. Admissions will be in 30-minute increments. We do have accommodations for those who are unable to purchase online, and there will be no more than 500 tickets sold each day for this part of our process. Oneida Shores Beach will be open starting Saturday. They will be open Friday through Sundays from 11 a.m. to 6 p.m. Capacity will be limited to 150 people. The beach is 45,000 square feet. Normal capacity is 350 people. Our personnel will be monitoring the beach closely to ensure proper physical distancing amongst all of our beach patrons. But again, 2 things that trying to get people the ability to get outside, enjoy your park system, and potentially de-densify some other parks. Related to the businesses that have signed up on New York Forward, we now have over 500 businesses that have signed up in Onondaga County. We're getting those updates each day. Again, if you have questions related to your business, what phase you're in, you can go to ongoved.com, our county economic development page, and you can leave a question there, an email there, or a complaint about a business that you think is open that shouldn't be open. And certainly, if you have a complaint, you can call 315-435-2210, and we will look into the complaint, see if it's a valid complaint. A reminder, our Child Care Solutions daycare program for essential employees, there are slots. We have extended it through the month of June. This will help related to restarts in Phase 2, Phase 3. And then usually the gap in child care for many families when kids would be in school, they get out of school in June anyways. So your traditional gap in child care for your household, you'll be, you probably had plans beforehand. So we tried to fill that gap in this period of time until you got there. And again, 211 for social, emotional support. Mental health is a challenge. It's part of our public health. And certainly we've been concerned about the limited liberties we've had over the past few months related to really what were daily activities that for the sake of public health have been limited. So that's had an impact and a toll in many ways, one of them being in the community's mental health. I think we've had a good week with mental health related to nice weather, some nice jobs announcements, and you're going to hear about a very nice story very soon that we're very proud of as well. But certainly if you need help to talk to someone, referrals, strategies, reach out to 211. Questions?
You mentioned yesterday that the 33 community spread might be related to Phase 1, going back to work for some people. Community spread today is 20. Any better insight into those numbers?
Yeah, I think so we're getting pretty close to our 7-day average. Our 7-day average won't be as low as it was last week, but your asymptomatic cases are kind of skewing it a little bit because of the proactive testing. But needless to say, I think our 7-day community spread average is going to be under 20 this week unless we get a big number tomorrow. And that's really kind of right in line where we've been. Our better weeks in the last 4 or 5 weeks have been closer to 12 or 11. Some of the other weeks were 18, 19. So if you still fall in that range in week 1 or restart, I think that's pretty promising.
So 33 could have just been one bad day.
Yeah, or we could have another 33, 30, 40 tomorrow. We could have 10, right? So I think in week 1, you've had everybody kind of getting back together again. And in addition to that, you've had very, very nice weather. So you've had 2 factors that really don't conform well to physical distancing. So these numbers are pretty good when you take that into consideration.
It had been at least a month since it was as high as 33 community spread-wise. Do you have in front of you when it was the last time?
I don't.
Okay.
I don't.
With the number of asymptomatic cases that you're seeing, do you have any concerns with opening the zoo or the beaches up, seeing that number?
No, I mean, you can't. The reality is that there's probably been lots of us who've been exposed one way or another to COVID. We just don't know it. And you have to learn how to live with the virus at this point. Society cannot just shut down for a year. That's not how things work, right? You can't, and so you have to find balance. And now, when you look at where our cases have gone, we've flattened the curve. Our hospital infrastructure is not in jeopardy. Our ability to trace and quarantine is not in jeopardy. So we need to do things and make policies that continue to make the public safe, but at the same time, public health isn't just COVID-19. And you have to find that balance in dealing with addiction. You got to find it in dealing with mental health. There's no way to pay for public health response if your economy shut down for a year. That's just not how things work. So we think we've found an appropriate balance every step of the way. And at some point, history will judge us on the decisions we've made in this process.
Brian, what if there is a spike this weekend because there is going to be nice weather? Do you close things down, and how do you enforce that?
Yeah, a spike in a day or two. Again, a spike would have to be that you saw a lot of cases and your infection rate jumped, right? Not just cases. You can't look at just cases anymore when we're doing 1,000 tests a day. You have to look at rates and percentages. So if you saw 100 new cases in community spread and you got back 200 tests, then you want to see what's going to happen the next day, because that would be alarming. If you saw 40 new cases in community spread and you got back 1,000 tests, your infection rate's 4%. That's the better end of where we've been. So I think the way that we all need to look at data now is I was very transparent that I thought the testing criteria that we've been put under is a little bit aggressive, okay? I've been very transparent about that. I still believe that. But now, because of that, because you're testing so much, you can't look at number of cases as a metric. You have to look at the percentages. And then you compare them to not just the cases from the week before, but the percentages from the week before. So it's all 1 day or 2 days. That's not enough to even be a trend. A week, 5, 7, 8 days, then you see something. Then you have to evaluate, what you're seeing. Does the data tell you a story why this is happening? Is it clustered? In our contact tracing, we would know very quickly if these people were at a park or if these people were at an event or a household party. We find out that information. And so that tells you a story. And if one of those stories is your public facilities, then you have to reassess that.
Seeing that number of asymptomatic cases over the last 3 days, are you urging more people to get tests done just to get a better, more accurate number?
Yeah, we got it open to anybody, so anybody can go and get a test. And I think more importantly, the message is we need people to remember it's here, and we don't know enough about an asymptomatic carrier, so we presume that that individual can spread the virus. They've handled the virus well, right? They got exposed to the virus. They have not gotten sick. Whether the exposure was a lot or a little, we don't know. But it's a reminder the virus is still here. So you need to be very, very diligent with your physical distancing and wearing a mask.
That 44%, because testing is open to everyone, is that just a cross-section of society, 44%? It's not specifically within a healthcare industry or
right.
Frontline, it's everybody.
It's everybody right now. And again, each data point, when you try to analyze and micro-target, which is what now we're trying to do, there might be some more micro-targeting within that analytics that we can maybe look for a different trend at some point. We just don't have it yet.
Is it fair to compare the infection rate now, these tests you're getting back, when you've expanded the testing, where before only you had to meet whatever list of criteria to even be eligible to get a test?
I don't think it's a good point. It's changed the way we look at everything. If under the old criteria, we wouldn't have had 44% of the cases, right? So we wouldn't be talking about 42 cases today. We'd be talking about 22. And everybody would be saying, hey, not bad, right? But you do all that testing, so then you find these cases because under the old criteria, we were only testing symptoms. It's part of the overall infection rate. It's more, this process by doing this testing gets more to what the antibody testing that was done earlier with New York State showed. It shows you do a lot of antibody testing. You're just looking for the overall infection rate of a community. If we keep on doing enough testing like that and we get these massive numbers moving forward, we'll get, again, probably closer to that 2.4% that we had today overall. And that's kind of, you'll just have so much information that your data will show you the true impact of it on the community. So right now, the week to week, the numbers probably aren't the easiest to look at, but as you continue to do this for a long period of time, the data becomes more valuable.
Is the health department still interested in those community spread investigations? Are they actually looking into if this was at a workplace, in a grocery store? That's still part of the process.
That's part of your contact tracing. Yep. So that's how you figure out who needs to be in a quarantine. Certainly you look for within your own cases how many, we talk about household contacts. There are other types of contacts with someone at work. How many people did they infect? How many people are positive? Those are a different type of affiliation. other than a household contact. So that's all done. That's part of the training that our 300 tracers got, was to learn how to do that, and that's part of their process when they have a case.
Do you have a read, or do you plan on meeting with Dr. Gupta about the 33 community spread to see if there's any kind of pattern?
Yeah, Dr. Gupta and I meet together every day for an hour, so we go over a lot of material each day. There's just not, the depth of analytics that we're into is better than anyone else. I'll challenge you to find another county that can talk about the numbers the way we can, but as I push to get your answers, it takes them a little bit of time.
So we're not there yet on yesterday's community spread?
No. And again, there might not be anything really to talk about either, right? Could just be you did over 1,000 tests back and you got 33 people in the community that had it, you know?
I think yesterday you said there were 700 businesses that were reopened. Was that across the region?
No, I think 470 was my number in Onondaga County. Yeah,
And then, do you have any idea of, like,
the other parts? Yeah, I don't think we're at 700 yet as a total. I didn't really pay attention. We can have that number tomorrow, though.
Do you have a breakdown of maybe what kind of businesses have certified that?
So the businesses that need to certify are the businesses that have been operating from day one as essential, and the businesses in phase one. Your phase two businesses, guidance will be coming out on that most likely next week, and then those businesses will need to go through the certification process as we move into phase two. But we're supposed to get a list of businesses that have certified. We have not gotten them yet, or I have not seen them yet, but I think they're coming. But I think overall, whether there's 700 in the region now, there might be. I don't know if, probably pretty close, Trish. We're slightly over 500.
Would you give hospitalization data again? How many are in there and how many you are?
82 in the hospital, 40 people waiting to be discharged.
So about half, you would argue, don't belong in a hospital right now.
Absolutely.
I've had a nursing home medical director suggest a COVID-19 specific nursing home is needed in this community. Then the governor issued his executive order about not sending COVID people from hospitals back to nursing homes. Is there a middle ground? Could you pick a facility that isn't a nursing home that would onboard only COVID-19 hospital discharges?
Yeah, so we got to figure this out. We're going to work this out. Right now, this is this is kind of like annoying because it really takes what was good data and throws it out the window. And for the hospitals, you have people there that aren't necessarily sick enough to be there, right? This isn't what the hospitals are essentially for. But I get what the governor's trying to do, right? You can't have people that could spread COVID back in nursing homes. We've learned from that. So we've put together these COVID units in these other buildings. We've asked the state to consider that. These folks go back there for a period of time, and if you want them to be in quarantine or isolation for a longer period of time, since when they go back, maybe that's how you do it. Or if there's a transitional facility that needs to be established to do that, if that's the rules, we'll work on it. Right now, this isn't, the hospitals are still functioning with these folks being there, but this is not sustainable from the standpoint that we know that there's COVID in our senior facilities, and we know that many of our seniors are going to need to go to the hospital. And so eventually your hospital percentages are going to keep going up and up and up to the point where the hospitals are being used as a dorm, and we can't have that. So we're working through it. These things, this has been a problem for 3 days. So hopefully by next week we'll have this worked out and there'll be a plan.
Do you know what you'd like to see, a transitional facility or the executive order be reversed so these COVID units could take on hospital discharges?
Either or. A transitional facility would mean you'd have to do more work and put together a new partnership, but we've been able to do that. But certainly when we needed the nursing homes to create COVID floors, and some of them created multiple COVID floors to take in residents from other nursing homes, they did that, and so we've done this. So whatever the guidance is, what you need us to do, we'll do. But having them be in a hospital when they don't need to be doesn't make a lot of sense.
Quickly on this topic, is it across the 3 hospital chains? Community is upstate, so I guess there's 4 hospitals. Is that problem, these 20 people or so in all 3 hospital systems?
Yeah, well, it's 40 today.
40.
But yeah, you have them. We get the numbers directly from those 3 hospitals, yeah.
Are hospitals like upstate running out of beds?
No, not now. But you can't. But here's what I can promise you, is that COVID is in these buildings. Okay, I just told you there's more senior-related cases today. Some of these residents are going to be sick enough where they're going to have to go to the hospital, and then they're going to get better at some point and need to go home. They can't go home now. So the 40s, unless we do something, that 40 is going to eventually become 50, and 60, and 70, and 80. Then all of a sudden, your 1,700 beds you have in the community, you're going to see capacity constraints because there's people who are sick for other reasons going to the hospitals.
So are the COVID floors at like the nursing homes, are they just filled? You can't
No, there's capacity. Under the current executive order, they can't go back in until they test negative. The challenge is if you have COVID right now, 10 days from now you're better, you get to go back to work. You get tested, you're going to test positive still. And then 2 weeks later you get tested, you're probably going to test positive again. So we don't know enough about when you will test negative, or else that would be the metric for you to be recovered. So that's the problem. That's the challenge.
Does the regional control group have the power to decide whether we move to the next phase? Can you make that decision?
Yeah, I think overall the metrics have been laid out, how you move to phase 2. I don't think there's not a control group. Our group isn't going to make that call. It's the metrics are there. There's not going to be people saying you can or can't do that. The data will speak for itself.
Ryan, has the county repurposed any workers to work as contact tracers?
We have cross-trained workers from other departments when necessary. We have not needed them at this point yet. And then, so if you need 300 people to do contact tracing, we would have a much bigger problem than where we are right now. So right now it's still our health department doing the contact tracing. We haven't had to bring in our other employees to do that at this point.
With the universal testing, is there a limit of how many times people can go? Can I go this week and then also go next week?
You could. It would be interesting. At some point, the insurance part of this is going to be really interesting. I think nursing homes have raised concerns about this and the costs, and certainly you can do that. You may be the first person to do that, but there's pioneers in everything. But at some point, you probably don't need to go every week unless you become symptomatic. But you technically could do that. We would not know we would not stop you from doing that.
Do you contact trace an asymptomatic person?
Yeah. Yeah.
And you treat it like they're contagious?
You have
people
to,
go into
right?
quarantine?
Because we just don't know enough about it. So we have to work under the assumption that they can spread it just like anyone else can. And again, I think when people are with each other and they see people, and maybe they're not as paranoid as they once were about people if they're coughing or sneezing, but they see somebody, they're happy, they feel great, they're running around, you can be asymptomatic, and we believe you can spread this. So that's why a mask is important if you're going to be within 6 feet of people.
How is the testing of nursing home employees
Good.
going?
We get an update every day on the tests that are done in nursing homes. They get built into our numbers. Wednesday is when they had to start that process. We're sure that our numbers will probably be very large, maybe today and tomorrow, with these nursing homes getting it done in the first 4 days. And the state did a nice job getting test kits to the facilities, so that at least that isn't a cost. That takes some of the pressure off the labs. We have teamed up nursing homes with labs, so that not one lab is getting inundated and backed up. Different nursing homes are working with different labs.
And there's like you say there's 1,000 nursing home employees?
There's about 4,950, and then you assisted living is on top of that as well. So you're talking about probably 11,000 tests a week from these facilities, two a week. A lot of testing.
Ryan, you mentioned daycares and that you have enough spots right now and you extended it through June. Going into the summer, is the county looking at maybe extending this as more businesses start to reopen? Do you have enough space, do you think, when summer comes around?
Yeah, so we're going to extend it through June because we met a gap. There certainly nobody expected their children to be out of school for this period of time in the beginning of the year. No way for families to plan for it. So we met that gap in time, that moment in time. We probably will not extend it into July and August. That's where traditional daycare strategies and planning needs to pick up. And that's why it's important that the summer camp guidance comes out. We figure out how we can do summer camps safely. For some reason, if summer camps don't get allowed to open up, then we might have to reassess this because folks, that's part of their daycare strategies for many families is summer camps for the kids. So we think that the summer camps will happen. They may happen. It may look a little bit different, just like everything else does, but hopefully we'll have guidance on that in short order.
That kind of brings me to today, the governor said that summer school will not be in person. Do you see that impacting summer camps and parks? And I mean, the governor said he wouldn't send his own kids to a summer camp. Do you have the same?
Did he say summer camp or summer school?
Summer camp.
Summer camp, yeah. Look, I think you need to be able to have. I understand his concern as a parent. Okay, I have 3 children as well, but it's all about balance and how you can do things safely. If you can't do a camp safely, then you probably shouldn't do it, right? If you can find a way to do it safely and mitigate the risk, then you probably can do it. And that's the balance that we need to find. And again, a lot of it is different. A summer camp where you have infection rates in the teens and 20s, a little bit different when, you know, our infection rate has been under 2. Now it's probably over 2 at this point, you know, in our community in central New York. So every region of the state's different, but certainly I think if we continue to progress in this fight with the virus, we learn more about the virus, learn more about how we can interact with each other in a safe way. Summer camps could be viable, and I hope we get to that point where they can open.
Sky Armory just...
Yeah, I think I got to know the information on the ground, but in this process, you learn a lot in a week. You learn a lot in 2 or 3 days. And that's why whenever I've been asked a question about something that's happening a month from now or 2 months from now, I'm hopeful that these things can happen because we learned so much about this. And you know, the restart down in Georgia and other parts of the state that was supposed to be a disaster hasn't happened. It hasn't been a disaster. So if you look at week 1 here, right, so far so good. So as this keeps going, you continue to find that balance, and every time you do something, you're essentially testing the virus. And if you continue to test the virus and it doesn't respond in a vicious way back, maybe the virus is weakening. We'll find out.
Sky Armory just announced it's planning to reopen for weddings as part of Phase 2. Do you agree that wedding venues are or aren't part of Phase 2?
I don't believe you can have lots of people together in Phase 2, so maybe there are some small weddings.
For Memorial Day, is the beach going to be open? Is there any ceremonies planned at all?
Yeah, no ceremonies. Oneida Shores is open. Some other areas, some of the private beaches might be open.
Talking about summer events, the schedule for the amphitheater is getting pretty empty.
Mm-hmm.
What do you think when you look at that calendar?
Man, what a season we were going to have too, right? So Many of the acts are booking for next year, but I think, this is kind of one of the things. It's like the fair. There's a lot of work done on the front end of it for these tours to go on, a lot of upfront costs. So you can't have these tours and only have 5 or 6 shows in August or September and make it work. So I think we're going to be in a situation where maybe we made a lot of progress with this virus and this fight. We'll be sitting in August wishing we were at the amphitheater listening to music. So we'll look at it. If we get in a position where the virus is we're in a spot as a community where we can have people together again at a venue like the amphitheater in August or September, maybe we'll think of some creative things to try to get people together and enjoy themselves.
On my way here today, I saw people not social distancing. We get emails every day of examples of people not social distancing. Do we need to accept that people just aren't going to follow directions and social distance? And should we still call 911 if we see that?
Related to parties and things of that nature, certainly those represent these large social gatherings. We need to hear about that. Like any rule, people break rules. People jaywalk every day, right? I wonder what percentage of people jaywalk every day. But you're going to have people that follow the rules very well, and you're going to have people that don't. And so part of that's built into this. Overall, I think we do a pretty good job. What we're concerned about is kind of these large gatherings. And when you talk about barbecues, larger barbecues, and more than 10 people getting together, we have concerns about that because we have documented cases where things like this have happened and people have gotten sick. And we don't want that for you. And I don't think you want it for yourself or your family either. So we need to continue to do what we know works and what has worked for us for almost 90 days now.
You can correct me if you have updated information, but I don't think one police agency has ticketed a person for not social distancing.
I don't know the answer to that.
The last check, it wasn't.
Yeah.
Is it even worth calling 911?
I think it is. Whether someone's ticketed doesn't mean that the police officers don't go to the location and look for them to break it up. So I think it is. The mass gatherings and mass right now is anything over 10. It just can't happen. There's too much risk.
What did the control group decide today or discuss today?
First off, I'm not the spokesman for the control group. I believe one of your colleagues said I was. I'm just very transparent. Related to the control group, we give an update every day on our numbers. Our numbers drive the region's numbers, and that's what really the control group is there for, is to look at the numbers, talk about them, trends, anything that can be done. So we gave that briefing, very quick meeting today. Just a couple questions, some of the data related to businesses, how many have attested. So we're getting that data, but very quick meeting today.
Ryan, one more question about the not in-person summer school. How does that affect the county level?
So I don't know how that affects it. I mean, summer school. And I know that there's various programming for kids who may have need some additional help, but for the most part, summer school is there to get kids caught up at grade level. So I think you can probably do that online. I think the challenge is we're not ready. If we were ready for summer school, why weren't we sending the kids back to school in June? Right? So I don't think that's a big surprise about summer school. The challenge is these buildings weren't built the way to keep kids away from each other. It's actually probably built the other way, just like the Civic Center. So it's going to take some time to figure out layouts, figure out schedules to get these kids ready for the fall. And that's when we need them ready, is the fall. So I'm not sure exactly what the impacts will be on the county for this, if there's any real impacts on us. But certainly it doesn't surprise me that there's not summer school. Because if you could make that call today and say there's going to be summer school, we should probably be sending the kids back to school in June.
And to that point, does it make planning for the fall harder, easier?
I think it's easier, right? It gives you time to continue to assess, continue to look at it. A lot of good, suggestions come our way. We forward it on to the state. You change up schedules, different ways. It's going to be a challenge, and there's parents that want the option. Can my kids distance learn? These are all things the state education department is going to have to consider with the feedback from the local school districts. Any other questions? Okay, well, I want to start giving you some thank yous. I want to thank the Syracuse Mets and the Dunkin' Donuts team, Tom Santuri of the Wolak Group, bringing coffee and Syracuse Mets hats to my health department. Whenever you do nice things for my health department, you get a shout out. And so thank you again for that. And I want to talk about a special individual and ask that Diane Kupperman comes up, our CEO of Make-A-Wish Foundation. She has a banner, so come on up, Diane. And let me tell you about this individual. He is a senior in high school, 18-year-old Caden Custer, Skinny Atlas High School. Caden is living with cystic fibrosis, which all of us know is a life-threatening genetic condition. He's been eligible for a wish for many years from our friends at Make-A-Wish, and we are joined by Diane with us below, right here. Diane, wave to everybody. Our friends at the food bank are here too. Wave to everybody. Caden recently learned that he was able to use his wish, and he wanted to give back, and he decided to use it to help those struggling with hunger. So to make Caden's wish come true, Make-A-Wish has partnered with the Central New York Food Bank to enhance their school break box program, which will now be renamed Caden's Wish Break Boxes. So Caden, pretty awesome. A total of 2,125 boxes will be distributed this summer to locations throughout Onondaga and Cayuga County. However, to make Caden's wish a success, he needs all of us to help with donations. So next Saturday, May 30th, from noon to 3 in the Embassy Suites parking lot by Destiny USA, there will be a food drive to accept donations. There will be a full list of items they're looking for on the Make-A-Wish Facebook page, as well as additional details. So please mark your calendars for May 30th from noon to 3, Embassy Suites, Destiny USA, for this food drive to help make Caden's wish come true. And this is just another great story of people in the community stepping up in different ways. And Caden is a very special senior who is really, for this to be his wish, to think about what's going on and to really think of others is just really remarkable. So Caden, thank you, and we're very proud of you. And I think that's a good way to end. Be safe.